We actually had a patient who came and talked to our team and said, you know, I missed Thanksgiving because you guys weren't ready. You know, it was 4 days, everybody synchronized their watches, I had people flying in. This maybe was my last Thanksgiving. So it gets me verklempt, you know. So we said, we got to do this. So we put that patient and their family on our team and drove from there. My company started working with Lean in 2002. So we've been doing it for about 8 years now, and in healthcare. So it's a fairly new industry for us, combining manufacturing principles with healthcare, but it's a perfect match. Probably the first thing that I worked on was we have patients who come in for chemotherapy to the hospital for a 4-day length stay, and they come maybe 4 to 6 times once every month. So we know they're coming, they're going to be there for 4 days, and we can expect this to treat, for example, lymphoma patients. But what we found was it was a planned visit for them, but not really for us. So we might not have a bed, we might not have drug available, we might not have a nurse available, we certainly didn't have orders ready to go, and maybe they even need something before they came to us, like a central line being placed, and none of that was done, and it was like a surprise every time they came, which was pleasant for us. Oh, it's good to see you again, but not so much for the person who's going through this process, who then had to wait about 6 hours for us to run around and get organized. It was terrible. We involved our patients and our patient families. Actually, one husband of one of our patients helped me collect data, and as they came in every month, he'd be like, all right, Martha, what do you got? Where are you at? Give me the clipboard, give me the stopwatch, tell me where we are. I'm starting it and going now, let's go, you know. So our process is less than 1 hour to the time of arrival now, and so we had to take it all apart, all the little pieces, a lot of setup reduction, a lot of pre-planned orders, having things ready, signaling systems, and moving some things upstream right to the patient. And so, but it was really rewarding work. I think that, you know, we have a lot to learn from manufacturing because they've been doing it so much longer. So they've really learned how to utilize the tools and have a lot of tips and tricks, and so there's a lot to learn from them. So we're going to take everything we can find because it's so important to do right away. So if I can learn from somebody who has, you know, 20 years experience and I've got 8 years, it's excellent. I'm going to steal everything they know as fast as I can. So that's why I'm here. It is rewarding and it's addicting, and you start to realize that you will accept nothing else. And so now you're ruined. You know, it's been really great. It's a very good conference. Yeah.